Hi everyone, this is Dr. Stella Jeffries. I'm a primary care provider in the state of Maryland and Washington, D.C. There have been many questions about what to do during this COVID-19 crisis. It is my job and my passion to provide the best possible education. It is up to us as individuals to keep ourselves, our family, and our friends safe and healthy during this time. Let us work together to take proper precaution to keep COVID-19 from spreading. And hence, here I am doing this video for you to give you some tips on one, things you can do to prevent yourself from becoming infected. Two, the proper use of personal protective equipment, also called PPE. One, prevention. Stay at home. As much as possible, avoid going everywhere and anywhere. We encourage you to call. If you're going to see your doctor, call for an appointment. We encourage you to try to avoid going in a crowded environment. We encourage you to try to avoid going to different occasions. Right now, we're all on quarantine. I think the quarantine is the best way for prevention. The stay at home policy. We must follow that. If the government put that in place, it's for a reason. The death rate is still so high. The curve is going up. And I think if we stay at home as much as possible, we can avoid becoming infected with this virus and also infecting our family members. It might not be about you. You might be healthy, you might be strong, but you might have other family member in the home that has a weaker immune system and they are compromised. So do yourself and your family member a favor and stay at home. Going to doctor's appointment, those are ground zero. As much as I love my office, but it is ground zero for the COVID-19. We sanitize, we disinfect, we clean, but it's still ground zero. So as much as possible, call before you go for those appointments. Going to the pharmacy is also ground zero. As much as possible, call before you go to the pharmacy. Try to make sure your medications is ready. You can go and pick it up. Being in a crowded pharmacy is very dangerous at this time. Okay, so that's number one. Number two, practice social distancing. It's important. We all miss our families and our friends. We miss going to those parties, those special occasions. But right now, it's important to stay to practice social distancing whilst also staying at home. You can do Skype, you can do FaceTime, you can do WhatsApp, you can do videos, you can do Zoom. To You can have Zoom parties, you can do FaceTime parties, Skype parties. Do whatever you can do to avoid being in a crowded location and to practice social distancing. Um, it's also important if you are in a location to practice is 6 feet away. Stay 6 feet away from a person. You can get this virus when a person just talk to you, they sneeze, if they cough, or if they are or have any kind of rhinitis, runny nose, whatever, you can get this virus. It's so important to practice social distancing. Please do not hug. Avoid hugging, avoid kissing as much as possible. Okay? So we said number one, stay at home. Number two, practice social distancing. Number three, wash your hands. Wash your hands. These hands, they are our best friend and they are our worst enemies right now. Wash your hands. You're going to have to wash your hands with soap and water for 20 seconds. You want to wash in between your hands, between your fingers. You want to wash under your nails. You want to do all of that. Wash your hands with soap and water for 20 seconds. Whenever you go out, you wash your hands when you come home. Whenever you have the opportunity to wash your hands, wash your hands. Also, keep your nails short. It's important to keep your nails short. We all know that bacteria, viruses, they get trapped on the long nails. And they're also, these long nails is a ground for germs and bacteria. So keep your nails short. Ladies, avoid wearing those gels, those manicures, or those clips, whatever it is you wear on your nails. Avoid the acrylics, the gels. Avoid doing those for right now. Keep your nails as short as possible and clean. And when you wash your hands, clean under your nails because the COVID-19 virus can also live under your nails. Okay. The next thing is do not touch your face. Do not touch your face. As a matter of fact, if you're able to wash your hands, wash your face a few times a day, wash your face. But do not touch your face. It's very, very important to avoid touching your face because the bacteria, the virus, once you touch your face, you touch your mouth, your nose. You don't even have to touch your mouth or your nose. Just touch your face. That virus can travel. It can transfer to your your oral mucosa, which is your nose and your mouth, and can also get into your eyes. So you want to avoid touching your face. Okay, and also disinfect Disinfect with approved EPA disinfectant. Read the labels. Disinfect your doorknobs, disinfect your car steering wheels, disinfect stuff in your house, furnitures, disinfect even when you go buy your grocery. Disinfect to wipe the grocery down, the boxes, the cans, all of those, wipe those down with disinfectant. Approved EPA disinfectant. That is important. Okay, if you disinfect, you will be able to avoid the virus from being transferred into your house. Also, it's important to use, you can use hand sanitizer as well. If you can find it right now, hand sanitizer is very scarce. So you can find hand sanitizer. It's good to use it. Keep one in your car, keep one in your purse. You can always use your hand sanitizer when you don't have means to wash your hands. Use hand sanitizer. Okay, it's important to use at least up to you have at least rubbing alcohol, which is up to 60%, 60% of rubbing alcohol in your hand sanitizer or even regular rubbing alcohol, 60% of that. You can use that to wash to get the virus off your hands as well. Also, it's important to protect your phone. This phone it can be very dangerous. If you're very dangerous, so make sure your phone is disinfected as well with disinfectant up to 60% of alcohol-based EPA product. Okay, if you, especially healthcare providers, if you don't have, it's important to also cover your phone. What I do, I put my phone in a plastic. I put it in a plastic when I'm at work. I seal it in here, and I use it all day in this plastic, so that when I'm at put in the plastic and seal it. So when I get home, I can remove this plastic, remove my phone from this plastic. You can get you can make another one, buy one. I'm not sure if they have it. I just made this myself. Okay, so I made this myself, and I can put my phone in here, and I can use it. You can actually use it, even punch the keys with this plastic. You can open your phone and use it to talk. Okay, while you at work. Okay, so when you get home, you still want to clean your phone, disinfect your phone when you get home, but at least you leave this plastic at work. So that way that your phone is almost a little bit not sterilized, well sterilized, but it's clean. Okay, and it's disinfected. So you don't take your phone and you put it to your ear or you start talking and a virus goes in your mouth, your nose, and there you have COVID-19. You're positive. So be careful with your phone. Okay. All right. You also want to make sure you're eating healthy. This is not the time to diet. You don't have to diet. Don't diet, or you don't have to diet right now. After coronavirus, we're all gonna go back on our diet that we're on. So you don't have to diet, okay? Eat healthy food. Making sure that you're eating, and also you want to boost your immune system with vitamin C. Vitamin C is so important at this time. So boost your immune system with vitamin C. Get you the lemon, get you the lime. If you can take multivitamin, get multivitamin. Okay. Lemon, lime, ginger, garlic, all of those things. I drink those twice a day, almost every day now. It's my part of my routine. Okay, because I want to keep my immune system healthy. Okay, and it's also important to keep yourself well hydrated. Drink lots of water because the virus, if it stays in your mouth and you drink, the water pushes it down to your stomach, and the acid in your stomach will dissolve the virus. Okay, it will get rid of it. So it does not live in an acidic place. Okay, so make sure you're drinking enough water every day. Maybe you drink your 6 to 8 glasses a day. Make sure you're drinking more. I said for those bottles, the 60-ounce bottles, drink 4 of those. Make sure you're well hydrated. Okay. Next thing we're going to talk about will be PPEs, which is the personal protective equipment. We know that those things are very scarce right now. We cannot find PPEs. Even from my office, they give us now is that you can only buy 1 box of gloves for the whole month. I'm like, how is that possible? We have enough our patients to last us for a while, so I'm grateful for that. But it's important for the regular people, the non-healthcare providers. You can wear cloth masks. I wear this one when I'm out. When I'm not at work, I wear this one. So what I do is I just go when I'm going to the grocery store and I'm at home or going out and I wear this cloth. Now this was made by my sister, so it doesn't have to be anything fancy. You can just wear this one. This is a regular mask that you can wear. I know they have it selling it. Some people are giving it for free. Some people are selling it. Some people are giving us a donation. But wear it. If you don't have it, get you a bandana. Whatever you can do for a face covering and cover your face. It's so important to cover your face. For the healthcare providers who are working with COVID-19 patients, there are some other masks you can wear, like this one here. It has a face shield, so I wear this as well. I wear this and I wear it to cover my face and protect my eye when I'm testing for patient. Also, I also wear. I will first wear my N95. I have N95 mask that I wear. I wear the N95 mask first. Okay, so I'm going to show you how this is done, how I do it. Okay, I wear the N95 mask, then I wear the face shield, either this one or I have another face shield that I wear. I wear this face shield as well. Okay, so either this one or the other one. But I always, when I'm testing, I triple mask, I double or triple mask because I know it's important. So I wear always my N95 and with a face shield, or I wear my I'm going to show you how it's done quickly. So I'm going to take off my glasses. First, I wear, like I said, I do triple mask. So I wear this regular one first. Put that on. Make sure that this is sealed. Make sure this is sealed well. Okay. Then I do have my gloves also. I wear my gloves. Then I'll put the N95 on next. Okay, make sure this is sealed well. Okay, then I can put my face shield on. And I always cover my hair. Okay, I comb my hair. It's important to cover your hair as well because the virus goes into your hair. So you got to wash your hair every day. If you're gonna wash your hair every day, make sure you're covering your hair well. Okay. Then I put my face sheet on. Okay. Put the face sheet on. Then when I'm testing, so I have two things that I wear. I wear this test suit. Okay. It's a full covering suit. It covers my whole body down to my feet, my legs, Okay, then after I wear this, and I put this on top of it. Okay, so I'm protecting myself where, because I want to protect my family. Okay, I want to treat my patients, but I also got to protect myself and protect my family. So I put all of these on, then I test my patients. Okay, and this is for healthcare workers. You have to protect yourself. Okay, so now I'm going to take this off and finish the talk. So the PPEs are your gloves, your face shield, your covering your hair, cover your shoes, okay, your N95 mask, the regular surgical mask for non-essential workers. It's a regular mask. You can use this just to go to the grocery stores and cover it, protect yourself. Okay, now I'm going to take some of these off. And to remove your gloves, you want to get the gloves like this. Put your hand in the glove. Okay, pull that, put it in your hand. Put one finger or two fingers under here and pull that, and then you get rid of the gloves. Okay, you put the gloves in the trash. Okay, and after you're done, you must wash your hands. Wash your hands, wash your hands again. Must wash your hands, okay? All right, now I didn't work any patients, so I'm just doing this video, okay? All right, so that is the PPE, okay? The N95 is important for essential workers, especially those who are testing. Okay, so if you're not testing, you can wear a regular surgical mask. Also, essential workers during the day, wear a regular surgical mask with your patients. Okay. Alrighty. So we'll talk about that. So how to discard your gloves and your mask. Okay. And some protocols for home. Okay, what you can do at home. It's important to, when you get home, take off your shoes before entering your home. Spray alcohol, spray your tops, your countertops, and with alcohol. Make sure you're disinfecting, cleaning everything. Okay. Also, don't forget to spray the bottom of your shoes too. Okay. Also, your cell phone. We talk about cell phone cleaning. Your glasses. When I get home, I wash my glasses. I clean it. Okay. My accessory, my necklaces, everything is clean. I'm washing everything down. Okay. Make sure you have some kind of alcohol-based product to wash everything down. Okay. If you go to the grocery store, you have receipt. Throw it with the receipts or your papers, anything that you get from these grocery stores. Okay. Like I said, they're your grocery, the boxes you bring home, in the cereal boxes, whatever you bring home, the can. Make sure you disinfect those with also alcohol-based product, EPA products, approved products. Do not touch or sit anywhere in chairs or in bed when you get home. When you get home, immediately take off your clothes, go upstairs, take a shower, wash your hair. Every time you go outside, you must come back in, take a shower, you wash your hair, wash your whole body, and make sure to wash the virus of your body. So whenever you go out, you come home, always take a shower. It's so important. Okay. Do not touch. Okay, or sit on chairs or bed. Go to the bathroom, take a shower, brush your teeth. Okay, brush your teeth as much as possible and to get the virus out of your mouth. Okay, and it goes to try to get out of your mouth so it doesn't go into your lungs or doesn't go into your throat. It goes into your goes into your mouth, your throat, down to your lungs, and then that's when it becomes a problem. Okay, so once the virus gets to your lungs, that's when you end up with the pneumonia that infiltrates, and you're on people on the ventilators, and most people don't do well. They don't come off the ventilator. So our goal is to prevent patients from getting into that state. So the best thing right now is primary prevention. Primary prevention. Okay. Like I said, I know you miss your families, you want to get them hugs, you want to touch, but again, social distancing is key. Stay at home is the key. If we do those basic things, we can avoid bringing this virus to our family, to our friends, and also to ourselves. Okay, so take precaution. Okay, take precaution. and we can all overcome this virus, okay? We can overcome it as much as possible. So thank you all for listening to me. Again, I'm Dr. Jeffries. Okay, I'm a primary care provider, and my goal is to help my patient to diagnose, to treat, and to provide the best possible care. Okay, so wherever you are in the United States, in Liberia, wherever you are, in whatever part of the world you are, we all should take heed to the precautionary measures that is being put in place. Nobody is invincible from this virus. Okay, so thank you very much. Have a wonderful day. Bye bye.